In the bustling halls of Saint Raphael Hospital, the staff was a whirlwind of white coats and stethoscopes, all orchestrated to the rhythm of beeping monitors and the rustling of medical records. At the heart of this thriving medical ecosystem lay the Radiology Department, where cutting-edge diagnostic imaging techniques held a crucial role in unraveling the mysteries of the human body. Once a field dominated by the X-ray machine, diagnostic imaging has since blossomed into a diverse array of techniques, each designed to visualize different aspects of the body's structure and function. Today, the department consisted of an arsenal of equipment: MRI machines, CT scanners, PET scanners, ultrasound technology, and the original yet substantially improved X-ray systems. Dr. Helen Cartwright, the head of the department, was an expert in utilizing these techniques. With her team, she aimed to provide the most accurate diagnoses, contributing immensely to patient care and treatment planning. The department's bustling corridors were filled with patients like Mr. Thompson, an elderly man scheduled for an MRI scan. He sat in the airy waiting room, his knitted sweater reflecting the years of life and experience written across his face. He couldn't help but feel a twinge of anxiety, the hospital's ambient hum doing little to assuage his nerves. As Mr. Thompson was called in, Dr. Cartwright welcomed him with a warm smile. "Don't worry, Mr. Thompson, the MRI scan is a non-invasive procedure, and it will help us understand exactly what's happening with your spine." She explained that magnetic resonance imaging uses strong magnetic fields and radio waves to generate detailed images of organs and tissues in the body, invaluable for her team to pinpoint abnormalities like tumors or inflammation. In another room, Sandra Morales, a young mother of two, was preparing for her ultrasound. With her smartphone in her hand, she Googled frantically, anxious despite knowing her third trimester was progressing normally. "This is just routine," the nurse reassured her as they guided her to the examination table. The ultrasound would produce live images of her baby, easing any concerns with a peek at her child in real time. Meanwhile, in the adjacent wing, Dr. James, the on-call radiologist, was overseeing a CT scan for a trauma patient. Time was of the essence. The sophisticated CT scan would provide fast images to detect internal injuries and bleeding, crucial for the emergency team ready to step in. The computed tomography scan employed a series of X-ray images taken from different angles, processed to create cross-sectional images of bones and soft tissues, revealing details that would have been unimaginable decades ago. On another floor, a sophisticated PET scan was underway. This technique allowed for an entire new level of analysis, combining the PET scan with CT imagery to assess metabolic processes, the very lifeblood of the body's hidden intricacies. Dr. Patel, one of the specialists, pointed out the advantages, particularly in oncology, as it helps in identifying areas of cancer spread by detecting increased metabolic activity usually associated with malignancy. As the day advanced, the team used the varying techniques not only to diagnose conditions but also in treatment planning and monitoring of diseases. For the doctors and their patients, technology served as both a detective and a guardian, laying bare almost every detail of the human body, a task that was, until recently, confined to the realm of imagination. The narrative of diagnostic imaging showed how science and technology converged to shine light into the opaque corners of the body. Each technique wielded by Saint Raphael's Radiology Department brought clarity out of chaos, giving patients around the world hope and offering doctors the precision they needed to save lives. In the words of Dr. Cartwright, "For every advance, there's a life we touch and a mystery we solve, bringing us one step closer to understanding the marvel that is the human body."